Hi Phoenicians, welcome back to the channel. Today we're exploring one of the most asked and most misunderstood topics in mental health, psychotropic medication. So if you're considering medication for anxiety, depression, mood swings or other mental health symptoms, this video is for you. We'll walk through the top questions and concerns people have when thinking about starting medication, so you can make an informed and empowered choice. Psychotropic medications are drugs that affect your brain chemistry. They're used to treat mental health conditions by helping regulate mood, thought, processes, and behavior. They don't fix everything, but for many people they help reduce symptoms so that therapy and daily life become more manageable. So, do you have to take medication to get better? No, not everyone needs medication. Many people find relief through therapy alone, especially when symptoms are mild to moderate, and not just those, of course, I must say. But if your symptoms are severe, long-lasting, or making daily life difficult, medication might be a helpful part of your treatment plan. So remember, it's not either or, it's often therapy plus medication that provides the best outcomes. However, therapy alone or medication alone might be helpful. It just depends. Now this one is a big fear. Will it change my personality? The answer is no. Medication doesn't change who you are. It aims to reduce the intensity of symptoms that might be clouding how you think or feel. You might feel more like yourself once symptoms like intrusive thoughts, panic, or low mood ease up. So side effects can happen, like headaches, nausea, changes in sleep, or sexual side effects, but they often settle within weeks. And if they don't, your GP or psychiatrist can adjust the dose or try a different medication. Remember, you're not locked in. Medication is a process, not a prison. Remember, you can ask for a review, so don't be afraid to work with your doctor. Will you be taking them forever? Not necessarily. Some people take medication for a short period, maybe 6 to 12 months, until symptoms are stable. Others may stay on it longer term, especially if they've had recurring episodes. So it depends on your condition, your goals, and how well you respond. Most antidepressants and mood stabilizers are not addictive. They don't create cravings or highs. However, some anti-anxiety medications like benzodiazepines can be habit-forming, especially if taken daily or long-term. These are typically used short-term and with caution. So how long does it take to work? This can be frustrating. Most antidepressants take 2 to 6 weeks to show noticeable effects. It's not instant, but it may be worth the wait. And remember, you don't have to go through that waiting period alone. Therapy and self-care can help during that time. Finding the right medication and the right dose sometimes takes trial and error. That's normal, and it doesn't mean you're beyond help. There are many options, and your GP or psychiatrist should work with you to find the best fit. Can you go to therapy while on medication? Absolutely, and in fact, it's encouraged. Medication can reduce the emotional noise enough that you can engage more deeply in therapy. However, sometimes they may make it harder for you to engage with therapy because of the emotional blunting or numbing. That's what I've found sometimes. But remember, it's not necessarily about choosing one over the other. It's about using the resources available and seeing what works for you. So what should you do if you're considering it? Start by speaking to a GP or psychiatrist. Be honest about your symptoms, concerns, and lifestyle. Ask questions and take your time. You don't have to rush a decision. Do remember that medication is one tool in the toolbox, not a cure-all, not a last resort, but sometimes a lifeline when things feel too hard to manage alone. So if you're considering it, I hope this video gave you some clarity and comfort. Remember, you're in charge of what you put in your body, so don't be afraid to take the lead. And please do share and subscribe, like, for more grounded, judgment-free mental health info if this has been helpful. It helps us understand what you'd like more of. And if you're considering medication, know that you're not alone, and what's great is that you're doing your research already. See you in the next one.